Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stefanie Christian. This month, we've been talking about neuromodulators. And in my practice, the ones I use are Botox and Xeomin. Today, I'm going to talk about how to use the neuromodulators to improve the appearance around the eyes. So specifically, how to address the crow's feet. These are the muscles that cause the fine lines and wrinkles here around the eyes, and how to use them to elevate the inner, middle, and outer eyebrow. So why do this? Well, the first reason is to think outside the mask, because this is 2020 and we're wearing masks. When we wear a mask, what do we see? We see the eyes. And the eyes are a focus of the face. It's where you see someone's intellect and their humor and their attention and engagement. And so we want to enhance that. And by softening the creases that are around the eye and by giving a very slight elevation to the eyebrows, we can open up this area and make you look more youthful and more rested. With one of the themes from last week, we talked about improving the posture of the face when we were talking about the forehead and the frowns, by strengthening the muscles that are elevating and by weakening the muscles that we're depressing. We're using that same philosophy here. We're going to weaken the muscles that are pulling down and allow the strengthening of the muscles that are elevating, so that ultimately we get a better balance and sort of a natural lift. So how do we do this? Well, Botox and Xeomin are temporary muscle relaxers that block the signal that causes the contraction of target muscles. Xeomin is a little different from Botox because it doesn't have any additives. It doesn't have additional proteins. And because of those two things, you are less likely to develop an allergy to it, and you are less likely to develop antibodies, and therefore less likely to reject it or less likely to become immune to it. Also with Xeomin, I can get a softer look while still reducing your fine lines and wrinkles. And how do we do these things? Well, first, we have a discussion about what are your goals, especially when it comes to crow's feet. It's really important to discuss how much of a muscle relaxation you want, especially with the crow's feet. It's important to discuss how much muscle relaxation you want. We have a very good unconscious ability to recognize a fake smile from a real smile. A fake smile involves the zygomaticus muscle right here. A fake smile lifts the corners of the mouth. A real smile is much more complex. It involves lifting of the cheek here and a little bit of squinting of the eyes. And we recognize this, and it has been studied extensively, so much so that a real smile has a name. It's called a Duchennes Smile. And there's a Duchennes marker. And the marker is that squinting and those fine lines. So if you're doing something where it's important that the people that you're interacting with see a real smile, like if you're a teacher with young children, or you're a social worker, or you're a pediatrician, or you're a nurse, you don't want to completely lose the ability to squint, to have that squinty smile that's part of a real smile. So it's important to have a discussion about how much paralysis do you want to have. Then I have you put ice on the muscles that we're going to be injecting. And I mark where I'm going to be injecting while you're making the tightest, squintiest smile, or you're raising your eyebrows the most possible. The ice is important The ice does two things. It numbs the skin and it shrinks the blood vessels. When I'm injecting, I wear loupes, and loupes allow me to see vessels that are even smaller than the ones I can see with my naked eye. Yet there are still smaller vessels that I can't see with the loupes. And so if I can shrink those vessels, it makes it even less likely that I'm going to hit them. So by putting on the ice, I'm numbing the skin and I'm decreasing the risk that you'll have a bruise. And then I use the smallest needle that you can get in the United States. So all in all, the injection is not very uncomfortable. So then I inject. And the muscles that I inject to cause the brow lift are these muscles that cause a frown, the middle of the brow and the side of the brow. But you have to be careful here. I have you raise your brow, and that drops off these muscles here, which are part of the lid movement, so that I make sure I'm just getting orbicularis oculi, which is that muscle that's involved. It goes all the way around the eye and it sort of scrunches up the tissue around the eye. And that's all I want to catch. And so I get it right there. I know I can tell where the vector is, the best way to get that nice little arch. And I inject right there. And then at the corner of the brow, right there. And those three spots are going to give me the best elevation. But it may turn out that looking at your brow, you don't need one of those spots, or you don't need, two of those spots. Some of this has to be the art of it. And then I inject the muscles that are causing your particular creases. And we can actually go fairly close underneath the eye. And then we have our results, and the results show up 7 to 14 days later, depending on which one we used. And the goal is to have a youthful, rested appearance and as natural a smile as possible, with decreased fine lines and wrinkles and a slight elevation of the brow. So I hope I've answered some questions about the way we use neuromodulators to improve the appearance around the eye. And if you have any questions, please just comment below. Have a great week, stay well, and I'll see you again next week.